Okay. Hey everyone, it is Clarity Jones, and I'm here with our favorite nurse practitioner,
Shemika.
and we're here to talk about diabetes. We've been talking about diabetes all month. So, what is diabetes?
Diabetes is a disease of the pancreas. Diabetes happens when your pancreas is not shooting out enough insulin to cover the sugar and carbohydrates that you eat on a daily basis. So what happens is you just have sugar and carbs flowing through your blood vessels, and it's not being used for energy. It's being stored as fat, and it's causing damage to all your organs.
Yeesh. Okay, is diabetes a genetic disorder? Is it genetic?
It has a genetic predisposition, meaning, so diabetes type 2 has a genetic predisposition, meaning if your mother, father, sister, or brother have diabetes, then most likely, if you don't take care of yourself, you'll have diabetes too. Diabetes type 1 is an autoimmune disease. It's just basically where your body is turning against itself. But type 2, it does have a genetic predisposition.
So, my next question was going to be who's at risk for diabetes? So, with type 2, you just said if a parent, a sibling, then likely you're at risk.
You're at risk.
So-
if you're obese,
So type 1.
well, not with type 1.
Not
Type
with
1
type
don't
1.
have the same characteristics as type 2. So type 2, if it has a genetic predisposition, so if your mom, father, sister, brother have diabetes, you might have it. Type 1, it's an autoimmune disease. So it's just for whatever reason, there's a lot of research that has been done, but for whatever reason, your body turns against itself. And they call it juvenile because you mostly get it as a child or a young adult. Type 2 diabetes, which is a whole different monster, that comes as a result of bad eating habit, genetics, bad eating habits, not exercising, not working out, things like that.
Okay. Now, I've always wondered why do people lose their limbs with this disease? Like what makes them get their limbs cut off?
So like earlier, I said the glucose is just freely flowing through your vessels, blood vessels. What it does is sugar is like crystals, and it make micro tears in your blood vessels, right? Mm-hmm. Blood is not getting down to your lower extremities, your legs, your feet, your toes. So you're not feeling any sensation, which we call neuropathy. You're not feeling any sensation. It's numb, it's tingling, all of those things. People hit their leg, their foot on a table or step on something. They have a sore, don't even know they have a sore. Before you know it, the sore is infected. And because there's no blood flow, no blood means death. Because there's no blood flow, the limb can't heal, and the next step is amputation. But you can catch it, and you can start taking care of that limb. Change your diet, bring your blood sugar down, bring your hemoglobin A1C down, and it will heal. I have seen them heal. As a matter of fact, I have pictures of people whose sores have healed or shrunk. But if you don't catch it, if you don't change your diet, if you don't start walking or doing something to get blood flow to those extremities, it won't heal, and you will lose your limbs.
Speaking of neuropathy, retinopathy, can you explain that?
Yeah. Retinopathy is it has the same characteristics, so to speak, as neuropathy. What happens is, because again, the sugar is free flowing. This is the thing that I don't like about diabetes. This is the thing that I hate about diabetes. Diabetes choose which organ it wants to affect and how many organs it wants to affect. So just like the free flowing sugar in your vessels, it's not allowing blood flow to get to your lower extremities. The same thing for your eyes. So you have blurred vision. The reason you have blurred vision is because your sugar levels are high. Your blood sugar levels are high. You feel like you have sand in your eyes. So I see people like digging in there, like rubbing their eyes. It's because their blood sugar is high. And eventually, again, if you don't take care of it, if you don't bring your hemoglobin A1C down, then you will lose your sight. You will.
Ooh. Okay. Is diabetes preventable?
Type 1 diabetes is not preventable. It's autoimmune. It's just something that happens as a result of your body turning against itself. Type 2 diabetes, 100% preventable.
Okay. And so, as far as diet, what does a diet look like for someone who is diabetic? And then I have a part 2.
What type of? Okay, so if you know that you are predisposed to diabetes, if your mom have diabetes, your father, sister, brother, any family member close like that, first generation relatives, and first generation relative is just, again, your mother, father, sister, brother, then your diet should be lower in simple carbohydrates, the whites, white sugar, white flour, white rice. That should just be eaten on special occasions, so to speak, not an everyday thing. Also, sugar, all types of sugar, even the fake sugars. You need to lower your intake of that. Last but not least, exercising. Walking is the simplest, less expensive thing that you could do to keep your blood sugar down. When you walk, what happens is your muscles, especially your quads, it snatches sugar out of your bloodstream and uses it for energy, and that brings your blood sugar down. So those are ways.
And so someone who is not predisposed to diabetes, doesn't have diabetes, would this be the same for them? Just monitor their carb intake, the whites, white bread, white rice.
Because the standard American diet is so poisonous, it's best for all of us to adopt a healthier diet, adopt a diet that's not rich in simple carbs like the white rice, white sugar, white bread, all of those things. So it's beneficial for us all to go into the whole grain, 100% whole grain arena, so to speak.
Okay, well, at the end of the day, you want to be talking to your PCP to see what's best for you. This is just a little Q&A about the disease. And if nothing else, Pinnacle is here to help. We are a diabetes management clinic. So we do all things. I like to call it your one-stop shop for diabetes care. Alrighty. Have a good one. Anything else?
Peace.
Stay mad, y'all.
That's right.